We are the party of the NHS, we back it, we're going to expand it, we've ring-fenced it and said it will get more money under a Conservative government, and it is our #1 mission to improve it. If you remember a few conference speeches ago, I said you could sum up our priorities in 3 letters: NHS.
The Tories broke their promise not to have another top-down reorganisation of the NHS. They did so by introducing the Health and Social Care Act that abolished SHAs and PCTS and replaced them with CCGs. Without permission, or little warning, the Tories have made patient records available to private health firms. The Tories defied a judge ruling and instructions by the Information Commissioner to publish the NHS risk register so that people could assess the dangers of the unprecedented NHS reorganisation caused by their 2012 Act. A third of the GPs making decisions on CCGs as to who wins NHS contracts actually has a financial link to a private health firm themselves. The Tories have handed over billions of pounds of NHS contracts to firms and at the same time exempted them from the Freedom of Information Act on the grounds that prying folk such as you and I will damage the commercial confidentiality of the companies. The UK Statistics Authority reprimanded Jeremy Hunt for claiming that median waits at accident and emergencies had halved under the Tories. The reality is that accident and emergency performance is at its worst in 11 years. A High Court judge and an Appeal Court judge both found Jeremy Hunt to have acted improperly in downgrading Lewisham Hospital. New clauses added to NHS legislation are designed to take power away from the public and concentrate it in the hands of private firms. The Tories have insisted that healthcare will not be exempt from TTIP. They have passed clauses to allow Jeremy Hunt to force NHS closures against the say of the local public, and diminish the court's role in holding him accountable. He has also passed regulations to push commercial competition in the NHS much more forcefully. All of this is anti-democratic. Jeremy Hunt and David Cameron have taken the ethics of the Department of Health to an all-time low. In particular, he seems hell-bent on distorting or exploiting data. Several senior NHS figures have had to formally intervene to apologise, or ask Cameron and Hunt to desist. The links between private health lobbyists and the Tories are extensive. This blurs the accountability and transparency of policy making. For an insight into just how deeply intertwined lobbyists and the Tories have become, see the evidence provided. Despite gaining billions of pounds in NHS contracts, private health firms are paying very little tax. You can measure the amount of tax each private health firm pays by typing their name into this database provided in our guide. You can also view an investigative report into private firms and tax avoidance. Tory MPs earn cash, shares, directorships and more from private health firms that are profiting from NHS privatisation. They mostly declare this income, and you can view it for yourself by referring to our guide. The Tories are at fault for scapegoating immigrants and blaming them for NHS budgetary pressures. For example, Jeremy Hunt said health tourists cost the NHS £2 billion. But evidence shows this was a gross exaggeration. Download the guide today to see 100 ways in which the Tories have failed you on the NHS.